Congratulations on your recent foot surgery. This video offers important post-operative instructions that you should follow to ensure a smooth recovery and positive results. Typically, your anesthesia should last between 12 to 24 hours after your surgery, so your first night should be relatively comfortable. You should expect some paresthesia or tingling in your feet in the next morning, which is a quite normal feeling once the anesthesia wears off. If anti-inflammatories were prescribed, you can start taking them in the morning after the surgery with food and during the recommended period. It should be noted that if you experience stomach burns or gastric reflux, these drugs can be stopped immediately and it is not mandatory to finish the full dose. If the pain in your foot is more important and painkillers have been prescribed, you can also start taking them, but remember, these medications can cause constipation and nausea or vomiting in some people, so take them only when needed. I remind you that your foot is going to swell considerably after your surgery and that your compression bandage is there to control the swelling. Elevation of the foot is the best way to minimize the swelling and thereby minimize the discomfort caused by an overly tight bandage. If you still feel throbbing in your foot, even when elevated, you should consider raising it a little more until you feel comfortable. Your foot will tell you when the height is adequate, and it is very normal to feel slight pain around the operated area in the first days following your operation. As discussed, a deep vein thrombosis is a vascular condition that can be relatively dangerous. This risk of phlebitis can be minimized by contracting the calf and by rotating your ankle when elevated. If crutches have been prescribed, then you must respect the complete discharge of the limb operated to avoid serious complications. If you have been given an inverted sandal along with the crutches, you can put your heel on the floor only when standing up to keep your balance. If a discharge boot has been prescribed along with the crutches, a full discharge is recommended at all times. It is okay to use a wheelchair or an office chair with wheels to move around inside the house. You should keep your dressing clean and dry until the next appointment. Your dressing is there to minimize the risk of infections and also serves to maintain the proper alignment of your foot and toes for optimal healing. If you wet the bandage by mistake or should it become loose, you have to get in touch with the clinic immediately so we can change it quickly. You can shower using a handheld shower head while sitting on a bench, making sure to keep your feet dry outside the stall. Range of motion exercises are usually recommended 1 week after the surgery. These movements aim to prevent adhesions and facilitate the evacuation of the edema around the operated site. They prepare you for an easier return to your shoes, so do them regularly and efficiently. These movements should be done about 20 times every hour by pushing the toe in maximum dorsiflexion and plantar flexion according to your tolerance. These movements can be done by you or with the help of someone else if needed, and they are extremely important. If you feel extreme pain in the area of your surgery that is not relieved by the pain medications or elevation, or develop fever, chills, cold sweats, fatigue, or general malaise, you could be developing an infection. You must inform us immediately, or if you're not successful in reaching us, you have to present yourself to the emergency department immediately for medical treatment. Finally, if you have any questions or concern about your surgery, do not hesitate to contact the clinic during opening hours or at the emergency number provided to you for the evenings or weekends. Have a great recovery.